Hi, I'm Dr. Caplan from Helios Telemedicine for Men, an online clinic treating unhealthy weight in any gender and men's hormone issues. Testosterone replacement therapy is known to suppress your body's production of testosterone and sperm. For men thinking about TRT but are interested in having children in the future, you should be aware of this. Some would recommend banking sperm prior to therapy. Others recommend the additional use of HCG, human chorionic gonadotropin, or Clomid to try to keep some sperm production. Either way, you should let your clinician know if you want kids or if you think you're having infertility problems. You may need to be referred to a male infertility specialist. I have discussed this issue with one, and his feeling is that they usually have success with pregnancy either through recovery of sperm count or in vitro fertilization in those guys who get their therapy in reputable clinics. It's those guys who get their roids at the gym or from a buddy that give them fits. So be careful where you get your therapy and communicate with your clinician when you decide you want to try for that little bundle of joy. For more information on low testosterone, its diagnosis and treatment, go to my website at www.heliostelemedicine.com. Make an appointment with me on the site if you live in Missouri, New York, Florida, or Texas. It's only $49 for the first visit. My videos live at www.youtube.com/@Helios Telemedicine. Thanks for your time and attention. Bye for now.